For pain control, what we typically use are anti-inflammatories, so ibuprofen, naproxen, acetaminophen, those kinds of things. If the pain is not responsive to then preoperatively, before the operation, you can use modalities like physical therapy and then those types of things. In addition to that, you can also use narcotics. Now, we try to avoid opioids as much as we can, but if the pain is intense, and for most patients preoperatively, they're in enough pain where they require that, because if they weren't having that much pain, they probably wouldn't have it operated on. So typically we try to avoid opioids if we can, but if the patient's in severe enough pain, we certainly use that. We try to minimize the use of it. Commonly used opioids are oxycodone or hydrocodone. And occasionally we also use hydromorphone if they're in a lot of pain. Postoperatively, when patients are going home, we'll continue that postoperatively as well as add a muscle relaxer. While they're in the hospital, we may use a PCA, which is basically a patient-controlled analgesia unit, which is an IV medicine, is used in the immediate postoperative period, where they hit the button every time they're in pain, and they get a small dose. And that's actually monitored so that if it's too much, it'll lock out so you can't overdose on it.